Hello, I'm Dr. Dennis McKenna, as always joined by Dr. Fred Venditti, our hospital system general director. Today is Thursday, December 10th, giving you the update from Albany Med. All right, first graph, Capital Region, 8 counties. Fred, we have a new record, 243 people in the hospital with COVID.
Not a record we want to have, but definitely a record, Dan.
There are definitely some numbers inside those numbers, so let's look at the next graph. These are admissions and discharges to Albany Medical Center. Now, Fred, normally in recent days we've been showing just maybe the last couple weeks.
Right.
This one takes us all the way back to the beginning again. We thought it would be helpful to do that. You can see the early peak. In the summer weeks, there were often many days without admissions.
That's right.
And now you can see, obviously, the newest trend.
It's back.
About 5 to 7, sometimes more admissions per day.
We've had double digit, 10
Right.
and 11, but similar number of discharges.
Which is what's helping keeping that number in check.
Right.
So currently in the hospital this morning, 63 people being treated for COVID, 50 on a medical floor, 13 in ICUs. Great number here, only 2 on ventilators,
That's
which
right.
is great. Let's break down that 63. Fred, are all 63 of the people in the hospital currently being actively treated for COVID?
So Dennis, 13 of those 63 we no longer consider infectious.
Right.
So it has to do with how long they've had the virus. And also we do measure within their blood antibodies.
Right.
And so if they have antibodies and it's been a long time since their first positive test, we consider them non-infectious.
So if we went back to that first graph when we saw that number, that 243 number, that's true not only at Albany Med, at other hospitals. There may
Correct.
be some people. So 13.
13.
Okay.
And we do talk about that on the regional call, so it definitely goes on in the other hospitals.
And then in that 63, give a breakdown. Are there any children in that group?
So Dennis, yes, there's a 17-year-old, and there's actually a baby in that category who I don't think is terribly ill. And then the other end of the spectrum, there's a 96-year-old.
Right. I think when we looked at it the other day, there was 7 people who were actually 90 or above.
Yes.
So, okay, very good. Today, Fred, you had the opportunity to join Albany County Executive Dan McCoy for his, I think, daily press conference. It was great of you. I'm sure they're very fortunate to have you. How did that go?
I thought it went well, Dennis.
Yeah.
A lot of questions from the press, a lot of questions about the vaccine, so
Right.
we talked a little bit about that. I got the opportunity to say to the press and whoever else was going to watch that press conference, same thing we've been saying here. You can do something about this. There's a role for everyone to play in this pandemic. Wear a mask, wash your hands, socially distant.
Excellent.
Yep.
Excellent. Can't say it enough. Speaking of communications, that was one vehicle to the public. We communicate a lot of different ways inside here at Albany Medical Center. We hear from time to time from people that there may be a question they have about that, and we think to ourselves, geez, we've covered that either in the video or messenger. So let's go back and talk about all the different ways in which we communicate here. We certainly do our videos
That's right.
twice a week. We send out messengers from time to time.
We do that actually 3 times a week now
Right.
after our COVID operations meeting, Monday, Wednesday, and Friday, so look for those.
So after we have the COVID ops, there's a specific messenger just for COVID that
That's
goes
right.
out. It covers a couple different things in those messengers.
Decisions that we make, changes to policy that are coming.
Right.
So it's very, very good. It's good information for everybody here.
The messengers we've sent out in the past are archived, and so if you have any questions, you can often go back and look at those. We have a YouTube channel, etc. But Fred, what do you think is the singular best way for us to communicate to our workforce?
Through our managers.
Okay.
That personal one-to-one or manager to staff at the huddle that they have in the morning or at other times when they're interacting, that's the best way to get the message across.
So both up and down at that level, so people can ask their managers questions. If the manager doesn't know that information, they can get it, and the managers should be obviously pushing information down to them that they're getting.
That's right.
Okay.
And you know, Dennis, the huddle board is a great place for this to happen.
Right.
You and I both walk the floors.
do.
We see staff, a change of shift in
Right.
front of that huddle board. That's a place for managers or shift leaders to talk about things.
Okay, very good. You mentioned that today there were some questions about the vaccine. This is incredibly exciting. I mean, it's great news. I've said it before, you've said it before, we're going to be vaccinating people here, our own workforce starting next week.
Yes.
Any update on that?
So today, right now, Dennis, as we're sitting here,
Yes.
the FDA panel is reviewing the Pfizer product. And I fully expect, you and I both have
Yes.
looked at the data, that at the end of that meeting, they're going to vote in favor of it being put out in a emergency use authorization. So we'll probably hear that around dinner time.
And we've actually heard, literally, the trucks with the vaccine in the appropriate cold storage are fueled up and ready to go. And once the word is out, they're out distributing. New York State will get it. They'll distribute it. We're one of the centers that'll get it, and
That's
we'll
right.
begin.
Some of the paraphernalia that we need, PPE, syringes, those kinds of things, are already packaged
Right.
and starting to be shipped around the country.
Right. Okay. So frontline providers here first, obviously, but there'll be a lot more discussion with our videos and others about how we vaccinate the community in the next weeks to months ahead.
Absolutely.
But great news. Let's change gears and talk about some non-COVID topics. It's always important to remind ourselves we have many missions here. Fred, we recently had an accreditation survey. This is where an entity will come in, regulators will come in and look at a clinical program we have or an educational program we had. Not surprisingly, we did great.
That's right, Dennis. So the FDA was here inspecting our mammography program. It's the MQSA, so it's the Mammography Quality Standardization Act.
Easy for you to say.
Easy for me to say, not so much. But we did great. We had no findings whatsoever. That was on Monday. Congratulations to that unit. Tremendous job.
So this is about screening for breast cancer, incredibly
That's right.
important program, so congratulations to all of them.
Important program even now with COVID. Don't forget.
Absolutely.
Get your mammography.
Absolutely. It's the holiday season, a time when we often look to try to help out those that may be more in need. On the intranet page today for our employees, please take a look at something called Neighbors in Need. This is an opportunity to make some donations to some really worthy causes. It's being sponsored by the Department of Family and Community Medicine here at Albany Medical Center.
Very
So,
important.
Yeah, very good. And then Fred, I think we had a DAISY Award winner. Remind us again what a DAISY Award winner is.
So the DAISY Award is an award given out based on a family or a patient calling out the service provided, the care provided by a nurse within our organization. And we get multiple nominations every month.
We do.
And then a group looks at those nominations and picks someone who's going to be the DAISY Award winner. So we have one today.
We did. Oh, I'm sorry, I flipped my page here. So Samantha Ray is the winner, and obviously got some incredible write-ups about the great care that she provides on D4 North.
D4 North in the cardiology world.
And so I think we popped her picture up there and
Yeah,
showed her.
Congratulations, Samantha.
For sure. And I think the unit gets cinnamon buns as a
They
result
do.
of that,
They
which
do.
is great.
Comes from the foundation.
Congratulations to Samantha. Well done. All right, and that'll do it. We'll be back again on Monday.
Tuesday.
Wait, what is today? Today's Tuesday?
Today is.
Oh, no, we'll be right. Today is Thursday.
Thursday.
We'll be back again next Tuesday.
Tuesday.
We're going to keep that in the reel because it shows we sometimes, I sometimes make mistakes. All right, we'll be back again on Tuesday.
Tuesday.
All right, very good. But we'll be working all weekend.
We will.
And which includes Friday, Saturday, and Sunday, just to prove that I do know the days of the week. We ask that you once again, please, take care of yourself, take care of each other, and we'll see you next Tuesday.